the cervical spine. So we have to strip the patient till here, and then we start with the cervical spine and then come to the shoulder slowly. So in C-spine, you look from the front, look from the side as well as from behind to see that if it is in symmetry, if there is any obvious deformities there. Then I will check the inspection and the palpation. The inspection will work, palpation. So I press on the cervical spine, the paraspinal area, here paraspinal area, and so the C-spine, there's no tenderness at all. If there is tenderness, there could be a degenerative condition or a disc prolapse, or it could be any spondylotic condition in the cervical spine. Then next step, what I would do is ask him to do an ROM of the neck. Look up, please. Look down. To the left. To the right. So this C-spine examination is over. Now we come to the shoulder. So I would start examination shoulder from the front, side, and then to the back. So the first thing we could see that look for any obvious swellings or any redness, any bony prominences, any cosmetic kind of deformities, and also look for any muscle wasting. So here we can start from the sternoclavicular joint, the clavicle, and the AC joint. So if you have, for example, an old fractured clavicle, you could see that there is a deformity there. There could be a malunited. Or if it is AC joint, you can see in an arthritic AC joint, there is always a prominence on one side compared to the opposite side. So AC joint, and then you come to the coracoid area. There's a coracoid area here, subcoracoid area, and the subacromial bursal area, and the deltoid. You can see there's no deltoid pasting. Whenever there's an accident of palsy, you can have deltoid pasting on this one. So here again, you look at the levator scapulae, the trapezius. You can see that whenever there's no wasting here. That's again very classic. In some patients can come to us with levator scapular overactivity or trapezitis. Then you can see that there's a prominence would be of the muscle in this area. Then coming posteriorly, we should always look for suprascapular and the infrascapular fossas. So in a classic rotator cuff tear, the supraspinatus or the infraspinatus of both, there could be severe wasting. Wasting could also be present when there's a suprascapular nerve compression. Because of any reason, a nerve compression can have wasting. Another important thing you have to see is for any obvious difference in the scapula, like winging of the scapula and scapular dyskinesis. That will describe more as special tests later.